Welcome to an all-new season of UrbanMD TV. UrbanMD TV is poised to continue our commitment to unpacking diseases and illnesses affecting our communities while showcasing the work of individuals on the front lines of wellness. On this season, we welcome a new shift of board-certified physicians as guests to our studio, including bariatric medicine specialist Dr. Jada Moore-Ruffin, sleep medicine doctor, Dr. Christopher Allen, adult psychiatrist, Dr. Marika Mimi Sanders, plastic surgeon, Dr. Nicholas Nip and Tuck Jones, dentist, Dr. Jarrett Manning, and more. Additionally, UrbanMD TV is expanding the brand by adding new faces to our on-air programming team, including gastroenterologist Dr. Angela Yee.
I am thrilled to talk about all things related to your gut health.
And OBGYN, Dr. Cynthia Wesley, aka Dr. Sin.
I'm so excited to be back at UrbanMD TV,
who each host episodes of UrbanMD TV this season. Plus, we're proud to announce a partnership with the Ad Council to present a 4-part series in collaboration with the Centers for Disease Control and Prevention, tackling pre-diabetes and type 2 diabetes, featuring Dr. Christopher Holliday. And of course, our two favorite co-hosts, board-certified family medicine physician, Dr. Lauren Powell, MD, aka the Culinary Doctor, and Dr. April Spencer, board-certified breast surgeon and founder of Dr. Spencer's Global Breast Health and Wellness Center, are back in the studio to anchor the #1 show designed to promote healthy living.
I am well caffeinated, I am well hydrated, I am well rested. I'm ready to go.
This is UrbanMD TV. On today's episode, is the culture's obsession with body thickness causing more harm than good? Weight loss specialist Dr. Jada Moore-Ruffin is in studio to share the dangers of obesity and deliver tips for weight management. Then, we double down on the critical importance of routine exams and the benefits of early detection through the testimony of Petersburg, Virginia Mayor Sam Parham, whose early detection of prostate cancer can be credited with saving his life. Also, our very own Dr. April Spencer travels to New York City to chat with iHeart radio personality Angela Yee in promotion of her new book, Treat It, Beat It, and Move On, a brain surgeon's guide to prevention, treatment, and thriving beyond breast cancer. UrbanMD TV starts now.
Hello and welcome to an all-new episode of UrbanMD TV. You know me, I'm Dr. Lauren Powell, your board-certified family medicine physician, also known as a culinary doctor.
And I'm Dr. April Spencer, board-certified breast surgeon and founder of Dr. Spencer's Global Breast Health and Wellness Center, and we are your co-hosts of UrbanMD TV, the first and only nationally broadcasted show dedicated to promoting healthy living through a multicultural lens.
Yes.
Let's jump into something that's been on many minds, including my own, in many of our group chats, and that's the obsession with being thick. There's this expectation in beauty in African American culture. It can often lead you to believe that having a little extra meat on your bones or having a little junk in your trunk.
Thick thighs save lives.
It's to be celebrated. I agree. However, sometimes these cultural factors and perception of what a voluptuous body image is like is playing a vital role in the ever-rising rate of obesity, actually, within the African American community.
According to the CDC, the prevalence of obesity in African Americans ages 18 and up is 49.6%. With obesity comes the increased risk of cancer, comes the increased risk of heart disease, diabetes, high cholesterol, dementia. So many things are associated with obesity that, and nobody intends to be obese, right? It kind of this thing that kind of happens, but maybe it's something that we need to be talking about.
And that's why I am glad we have Dr. Jada Moore-Ruffin with us here today. She's a bariatric medicine specialist and author of, get this, Girl, Get Ready to Lose the Damn Weight. That is the title. Can't wait. Dr. Jada, welcome to the show.
Thank you, Dr. April. Thank you, Dr. Lauren Powell, for having me here today. I'm excited and ready to get started.
Let's do it.
So Jada, we're talking about being voluptuous. We're talking about thick thighs saving lives. And your space of obesity medicine Tell me, I want to take a different spin on this question. If somebody comes in and they desire to lose weight, but they're hesitant because I don't want to lose too much weight. I'm not trying to be skinny.
Right.
I still want to keep my butt, my boobs, my thighs.
All the things.
All the things.
All the things.
But maybe you understand that there's a bit of a hindrance in their unwillingness to lose a certain amount that you maybe feel like is a hindrance to their health. What would you say, and how do you kind of manage that?
Absolutely. So if we get into that, if we really talk about it, we talk about this conversation of thick. So I have this thing of thick versus too thick. And that could be someone who, again, wants to have weight in all the right places, but you don't. You have weight in places that are not right. And in fact, being heavier in the midsection, for example, can be an indicator of health conditions that you don't want to have. If we're losing weight, we can't take it from one place or another.
I wish we could.
But
I think that's called surgery, right?
I think that's called surgery. That's a whole nother topic.
Dr. Jada, we're going to take a break. We're just getting started. Next up, after the break, I want to talk about weight loss drugs. Just pause on that. We'll be right back.
In today's fast-paced world, taking control of your health has never been more important. Introducing the UrbanMD Health Network, your one-stop digital destination to find and book appointments with top doctors in your area. Shop health and wellness products and access health services and resources throughout the country in just one click. Click on the QR code on the screen and register for free. Take a step towards a healthier you with the UrbanMD Health Network, connecting communities to care.
Welcome back to UrbanMD TV. Listen, we are still here with Dr. Jada Moore-Ruffin, the Dr. Jada Moore-Ruffin, obesity medicine specialist, talking about this obsession with being thick, but also kind of teetering along the dangers of obesity. And so, y'all know we can't go too far down the rabbit hole of conversation about weight loss without talking about all of these medications, both on the market and off the market, that are now available. So Dr. Jada, you've been doing obesity medicine for decades. These medications aren't new to you. They may be new to other folks, but they're not new to you. Tell us just kind of your thoughts and how you've used these tools in your toolbox for years.
I like the way you phrased that, tools in the toolbox. And having medications to support and help with weight loss is not a novel thing. We just have some newer things out on the market to use. The GLP-1s, everybody, this is the buzz. I think it's like crazy to see. And part of it is because of the direct-to-consumer marketing.
Yeah, sure. Yeah.
So now things that you used to have to go to the doctor to be prescribed or to hear about, it's like coming at you every
You literally can get it
single-
online. You will get an instant a DM on Instagram.
You can get it at the gas station, I think. Like your grandmama's dresser. Like it's crazy, the access to it. And it's almost, kind of borderlining becoming a fad and a crutch.
Everyone thinks that they should get it if they want to lose weight. And so it has to be an ideal candidate. So is there a particular type that you think might be most helpful? Because many people, whether they have diabetes or not, are taking advantage of the medications to try to lose weight. But we have to remember that it's not like a magic pill.
So when we start to look at that ideal candidate for some of these medications, first of all, we need to look at what their weight is. We have some people that are just kind of using it and just because they want to look thinner in a swimsuit in a couple of months. You're probably not the right candidate for that. Some people that are just emotional eaters, their behaviors are something that is more of a challenge than their eating patterns. I think someone who probably is borderlining like pre-diabetes, has some insulin resistance, are PCOSers, people who have issues with inflammation, people who have high cortisol levels are better candidates.
How do they sustain the weight loss? You mentioned lifestyle, but is this something they're going to have to continue with to keep the weight off?
With the studies that are coming out to look at the longevity of safety with these medications, we could certainly end up this being one of those medications that people are just on for a lifetime. And mind you, that people are starting these medications earlier in their teens and 20s. So the idea of being on a chronic medication for the next 30, 40, 50 years, I think it's a lot to think about.
And the thing is, we don't know everything there is to know
We don't
have
that kind of data, right? I mean, yes, we've been using these medications for diabetes, so we have long-term data about what it is for a diabetic to be taking these medications long-term. But for someone without diabetes, for someone who's under the age of 18, we don't have that data. And that's why, Jada, what you do is important because people need to be under the supervision of a physician.
So as author of Girl, Get Ready to Lose the Damn Weight. I
feel
love
like you
that
have to
title.
snap. I feel like you have to snap when you say the title.
With the Z. So what is your recommended plan for dropping pounds? What's your secret to recipe for getting those pounds off and making sure they're sustainable for people?
Understanding why this is important for you, whether it's your health, whether it's your business. I have some people that are like, I have a brand and I have a clothing line and I don't even want to be seen in my own clothes. I don't want to do photo shoots. And I don't judge your why. Mm-hmm. Whatever gets you to the conversation is perfect enough.
That's a good way.
Because we're going to learn things. You're going to learn things. I'm going to learn things. And we're going to start to really develop a holistic concept of why this is important. The 3 things I always say is how you look, feel, and function. Mm-hmm. And those may be in any relationship. Like, look may matter a whole lot more than how you feel. How you feel may matter a little less than how you function. So looking at those 3 things. The other thing is taking inventory of what you really want. What is your goal? And how can we chunk that down and make it doable? Make it something that's enjoyable. A lot of times people are like, well, I'm going to the gym and I'm doing these things, but you
want
don't
to set
enjoy
people
it.
up for success.
You want to set them up for success and sustainability.
Exactly. Sustainability.
Because this yo-yo effect of this up and down, let me try this and then I'll try something else again later. You know, it gets tiring, and that affects the psyche, the psychology of how you feel about yourself. We start to see low self-esteem, low self-confidence, and those are not good ingredients in the recipe of success when it comes to weight loss. So some of it, a good bit of it, is what you consume. A lot of it is how you think about yourself, your mindset, and then the stick-with-it ability, stick-with-itness, consistency.
I love that, and I'm so glad you shared that, and great way to wrap us up with that.
Thank you, Dr. Jada, so much for joining us. You know, I love talking to you. I learn so much from you. Every time we're together, you're the best.
Thank you. I appreciate you having me here. It's been my pleasure.
And we can't wait to get the book.
The book.
So if you haven't already, be sure to pick up Dr. Moore-Ruffin's book, Girl, Get Ready to Lose the Damn Weight. It's a fantastic read. It's a wonderful resource that will empower you on your health journey.
Listen, do not go anywhere.
When we return, the mayor of Petersburg, Virginia, shares a heartfelt account of how early detection was crucial in saving his life. Then later, Dr. Spencer hits the streets of New York City en route to iHeartRadio's syndicated radio show, Way Up with Angela Yee, to discuss her new book, Treat It, Beat It, and Move On, a praying surgeon's guide to prevention, treatment, and thriving beyond breast cancer. We'll be right back with more UrbanMD TV. Attention, physicians, community health centers, hospitals, and providers. Are you ready to expand your reach or elevate your practice? Join the all-new UrbanMD Health Network by creating your free profile and establishing a powerful digital presence that connects you with patients, provides a platform to book appointments, and sell your products. With UrbanMD TV promoting the digital destination on air, your practice, organization, or facility will gain national exposure. Click the QR code on screen and select Providers to complete your free registration today. The UrbanMD Health Network, connecting communities to care.
I'm worried about Mom.
Mom? She's fine. These the ones, right, Mom?
Yeah, groundlings.
Sweet potatoes.
Daddy, it's salty.
Some things come with age.
And some don't.
Early detection of Alzheimer's can lead to better care for your loved one. Learn the early warning signs at 10signs.org.
Welcome back to UrbanMD TV. Annual checkups are essential for maintaining overall health and preventing serious issues down the road. Sam Parham, mayor of Petersburg, Virginia, knows this all too well. It was during a routine appointment where his doctor started to notice a serious change. This is an UrbanMD TV testimony.
3 years ago, I was going to the doctor and it was monitoring my PSA levels. It crept up from 1 year to a 1. Year 2, it went to a 3. And then when it went up to a 5, the doctor says, okay, we really need to look at getting a biopsy done to figure out why your PSA levels are creeping up. They discovered that I had prostate cancer in my upper and lower prostate. At the time, they said that that my cancer was so aggressive that the seed implants would not have been enough, that I would have to do a mix of the seed implants along with the radiation. And he thought that because of my age, it would be a good idea for me to see another doctor named Dr. Robert Nelson Jr., who does a procedure called the Da Vinci prostatectomy. The importance for me doing that was because of my age. I was 48 at the time. My chance of the cancer reoccurring was a 12% chance, which was very high. It's a 0% chance of the cancer coming back with the complete removal of the prostate. They did 4 incisions here and then removed the prostate through my belly button. And from there, it was just healing and recovery. It was no type of chemo or radiation involved. The biggest thing was just for me to rest and recuperate, which is something that was difficult for me to do, but I learned to slow down and do it. It wasn't all rosy. The tough part was having a catheter for a week, and a week with the catheter was a rough time with the catheter, but it was a small price to pay to be cancer-free. The thing that saved my life was really the early detection, and you just can't stress the importance of going to the doctor for those regular checkups. Because look, here it is, I'm 48 years old, and the only thing that's telling me that I have prostate cancer is coming from a PSA test. Other than that, I didn't have any other symptoms. And it's something that I think about a lot, because if I wasn't going to the doctor on a regular for those checkups, 5 years later, I would have probably been dead in my 50s. So it's just important to do those regular checkups and do what you need to do to take health seriously. Because just because you feel good and look good doesn't mean it's not there.
Mayor Parham's story reinforces just how vital annual checkups actually are. A quick visit can save your life. Make sure to take charge of your health and schedule a checkup if you haven't. When we return, our own Dr. April Spencer hits the streets of New York en route to iHeart Radio's syndicated radio show, Way Up with Angela Yee.
What's up, it's Angela Yee, and you're watching UrbanMD TV.
In today's fast-paced world, taking control of your health has never been more important. Introducing the UrbanMD Health Network, your one-stop digital destination to find and book appointments with top doctors in your area. Shop health and wellness products, and access health services and resources throughout the country in just one click. Click on the QR code on the screen and register for free. Take a step towards a healthier you with the UrbanMD Health Network, connecting communities to care. Welcome back to UrbanMD TV, where it's time to shine a spotlight on our very own UrbanMD TV co-host, Dr. April Spencer, who recently took a bite out of the Big Apple when she journeyed to iHeartRadio's New York studio to be a guest on radio personality Angela Yee's syndicated radio show, Way Up with Angela Yee.
What's up? It's Way Up with Angela Yee. Dr. April Spencer is here with us.
Yes, hi, so happy to be here.
The book is called Treat It, Beat It, and Move On.
Yes.
So what made you title it that?
In our culture, we have been celebrating being a survivor.
Yeah.
And I submit to you, we are much better than being a survivor.
Yes,
we are
come on,
thrivers.
Yes.
And so my goal was just to allow women to know that you can get your power back.
Right.
And men to know they can get their power back. And so surviving means you're barely getting by, and we are existing in a shell of ourselves. And so it's like, listen, we lean on our advocates, we lean on prayer, we lean on spirituality. We bring in all the troops to complement. You don't have to choose. And so I wanted people to know that you're going to treat it, you're going to beat it, and you move on in the sense that, listen, you're going to live.
Right. And I want to ask you this too, Dr. April Spencer, because I'm sure there are people who, in that, I don't want to do this, I don't trust going to the doctor, I don't want radiation, I don't want to do those things, I just need to change my diet and figure out how to take it from there. What would you say to a patient like that?
They say it all the time.
All the
and
time.
what I share with them is, listen, what the studies show, I have evidence-based practice, so it's no pseudoscience talk. So I say, listen, what the data show is women that just check the medical boxes and do your surgery, your chemo and radiation, have certain outcomes. Women that only do their herbs and supplements and go at it alone have another outcome. But what we know is when you complement them together, you have the absolute best outcome. So I share with my women, you don't have to stop what you're doing. In fact, if what you're doing is making you feel better and you're feeling strong, you can continue that. But we also are going to have to go to surgery and get this tumor out. We're also going to need chemotherapy possibly, and you may need radiation. But I want you to continue on your wellness path because you have to do what makes sense for you. Because everything we do, there's inherent risk involved. But I think people feel empowered. The patients feel like I'm not making them feel bad for doing it. I don't even call it alternative medicine. I call it complementary. The complementary approach, and I would always do this. We're going to do it together. And that gives you the best possible outcomes. Thank you for having me. It is a privilege to have the podium.
Bravo, Dr. Spencer. And big thanks to Angela Yee for continuing to be an advocate for women's health. Thank you to Dr. Jada Moore-Ruffin and Mayor Sam Parham for joining us today. Remember, follow us on IG and Facebook at UrbanMD TV and subscribe on YouTube. Until the next episode, live well. UrbanMD TV is proudly produced by John Marc Sandifer for Sandifer Networks.